Hey guys, welcome back to UWorld's Next Gen NCLEX review. My name is Nkoli, or today I am the big bad wolf from y'all's favorite childhood stories. Happy Halloween. I am dressed up for the company's Halloween party all in the office. So if you participate, happy Halloween. But if not, welcome back to UWorld's question drill. Today's question topic is pharmacology questions. So think all things medication names, the pathology, the drug names, classifications. Things can be a little bit hard, so everyone give each other grace as we answer these difficult questions. If you're new here, I will explain how it works. I will read the question off to you, give you about 30 seconds to think about the answers. Drop your answers in the chat. We have Cinderella here moderating for us today, also known as Samantha. So if I cut off some of the questions or if I breeze by the answers, she will drop off the answers in the chat, and we can have an open discussion in the chat as well. So let's get to it. Question 1. The nurse has taught a client with hypertension who has new prescription for Ramipril. Which of the following statements by the client would require follow-up? I'll give y'all 30 seconds. Option 1, I should discontinue the medication if I develop swelling of my lips or eyes. Option 2, I will avoid taking a potassium supplement with the medication. Option 3, I can continue taking the medication if I become pregnant. And option 4, I may develop a dry cough while taking the medication. Drop your answers in the chat and let us know what you guys think. Make sure to also share, like, and follow us on all your favorite social media platforms: Facebook, Instagram, TikTok, all of them, YouTube as well. We love to have the communities grow each and every live session, so be sure to do that. Let's see what the answer for this one is. Option 3, I can continue taking the medication if pregnant. So requires follow-up in this question, meaning we need to know what is not safe for the client. Ramipril is an ACE inhibitor medication used to lower the blood pressure. It works by preventing angiotensin 1 to convert into angiotensin 2, which allows for vasodilation, which allows the blood pressure to drop. So the answer choices here are showing different side effects of ACE inhibitors. So we need to know which one basically is not a side effect of, or is something that we need to follow up on. So option 3, I can continue taking the medication if I become pregnant. This is not true. ACE inhibitors are a teratogenic medication, so it can affect the fetus. So we do not want to give it to our clients that are pregnant. Option 1 is a true statement. This is showing angioedema. Swelling of the eyes, the lips is a side effect that often happens with ACE inhibitors. And is an expected finding sometimes. Option 2, ACE inhibitors can cause hyperkalemia, which is a high potassium in your blood. And if you take potassium supplements as well, that can further cause hyperkalemia, which we know leads to cardiac arrhythmias. And that is something we do not want. So we don't want to encourage them to take any potassium supplements. And then option 4, they may develop a dry cough. Another very big common symptom with ACE inhibitors. They definitely have a dry cough, which is a lot of times the reason why clients don't like taking this medications and would request to switch. But it is a common expected finding. So you guys did good. Let's move on to question number 2. The nurse is caring for a client who's receiving sertraline. It would require follow-up if the client reports what? Option 1, drowsiness and fatigue. Option 2, diaphoresis and fever. Option 3, decreased libido. And option 4, weight gain. Let us know what you guys think in the chat. And also let us know where you tuning in from. If you're here in America, are you participating in Halloween like I am myself? Or if you're across the country and I'm looking a little weird, let us know where you're coming in and tuning in from. We'd love to see what where UWorld touches. And lots of good answers. Love to see it. I see Mr. Mason from Southlake. That's just down the road here in Dallas. I see Sweden again, Dallas, and lots of good answers. Pakistan, UK, Philippines, Zambia. It's reaching all over. Ohio. Good stuff. Okay, the answer for this one is option 2, diaphoresis and fever. With this question, we need to know what sertraline is. Sertraline is an SSRI, which is a selective serotonin reuptake inhibitor. Very long name, which we condense into an SSRI. A medication used to treat depression. It affects the serotonin in our body. We naturally have serotonin in our body, and so this medication also alters and affects and increases serotonin. If we have too much serotonin in our body, this can be life-threatening, which is shown in serotonin syndrome, which is the symptoms of serotonin syndrome is hypertension, hyperthermia, tachycardia, diaphoresis, and fever. So those are the two options that would give us the correct answer for this one, which is showing serotonin syndrome. We see all the other options. These are unfortunately common side effects of sertraline or other depression medications. So drowsiness and fatigue, decreased libido, and weight gain. Those are all common side effects of, unfortunately, SSRIs. But the diaphoresis and fever, that's going to alert us that something is excessive and toxic in our body, which is showing us the serotonin, and that would be the correct answer in this choice. So good job, guys. Question 3. The nurse is caring for a client who's receiving IV vancomycin through a peripheral venous access device, a VAD. Which of the following actions should the nurse take? Select all that apply. So more than one right answer. 30 seconds. I'll give 45 seconds. Instruct the client to report any hearing changes. Option 2, monitor the VAD insertion site frequently for erythema and swelling. Option 3, use an infusion pump to administer the medication over 20 minutes. Option 4, check the client's serum creatinine level prior to administering the medication. And option 5, obtain a serum trough level after administering a scheduled dose of the medication. Drop your answers in the chat. Again, a select all that applies, so there's going to be more than one right answer. Let us know. Also, be sure to check us out online at uworldnursing.com. We have lots of lectures. You can create flashcards, study guides, a lot of great resources for you as you prepare to take the NCLEX. And there's lots of buying packages online as well. And then we do have the free 7-day trial if you are interested in that and seeing what all we have to offer. So let's move on to the answer. Options 1, 2, and 4 are the correct answers. With select all that apply, I think of them as true and false questions. So option 1, instruct the client to report any hearing changes. This is correct. Vancomycin is a antibiotic medication used to treat infection. It has a narrow therapeutic window and it can be very hard on the kidneys, but it also can create hearing changes. And people experience ringing in their ears, which is a rush feeling. We call it a vancomycin flushing, and we don't want that to happen. So we want to monitor the client for any ringing or hearing changes. And then also option 2, monitor the VAD insertion site frequently for erythema and swelling. It is very hard on the kidneys, but also on the skin as well. So we just want to make sure that it doesn't infiltrate in any IV access sites. And then option 4, check the client's serum creatinine level prior to administering the medication. Definitely want to do that. As I said, it's nephrotoxic, hard on the kidneys. We want to make sure that it's not causing any kidney damage. So continuing to monitor with blood serum checks every day and every so often while they're on this medication. Option 3 is incorrect because we want to infuse it much longer than 20 minutes. That would be a little too harsh on the veins and on the kidneys. So we want to administer it for at least 60 minutes, or else you would be having that kidney injury possibly, or hearing the ringing in your ears. And then option 5, a trough is often obtained before administering, usually the third or fourth dose of vancomycin. So the key word in here is administering before, not after the scheduled dose. So good job, guys. Y'all did great on that. Question 4. The nurse is caring for a client with a new mechanical heart valve. The nurse should expect the client will be prescribed what? Option 1, warfarin. Option 2, Digoxin. Option 3, tacrolimus. And option 4, apixaban. Let me know what you guys think in the chat. Also, let me know if you are participating in Halloween, what are you guys dressing up as? I feel like me being the big bad wolf is easy because I'm comfortable in pajamas and then have my little mittens. But let me know what you guys are wearing for this Halloween season. And your answer choices as well. Lots of correct answers in the chat already. Good job, guys. Yes, keep those answers coming. Okay. Correct answer for this one is option 1. A lot of these other options are anticoagulants, but these anticoagulants are having effect on different enzymes of the blood. So we need to be specific which type of anticoagulant we are going to be using. So warfarin is a vitamin K antagonist used to prevent the thrombus from forming. It is a drug choice that most providers use for mechanical heart valves and would be our correct answer. Digoxin is a thrombin inhibitor. It is actually contraindicated in clients with a mechanical heart valve. So that would be an incorrect option. Option 3, tacrolimus. This is used for immunosuppressant if they have an organ donation or if they receive an organ. So not necessarily used in this case. And then apixaban. This is a factor XA inhibitor, also used to prevent thromboembolisms, but this is mostly used for patients that already have an increased risk of clot formation, such as atrial fibrillation. So not really used in this case. Warfarin would be our long-term treatment for a client with mechanical heart valve. So you guys did very good. Question 5. The nurse has taught the spouse of a client with hepatic encephalopathy who is receiving lactulose. Which of the following statements by the client's spouse would indicate a correct understanding of the teaching? Option 1, the medication may cause constipation. Option 2, the medication is administered as an injection. Option 3, the medication will improve my spouse's confusion. And option 4, the medication will decrease my spouse's liver enzyme levels. Let us know what you guys think in the chat. Also, to note that we have a new package new payment plan that is added on our site called Affirm, which lets you split up the payment into 3, 6, 12-month payment plan, especially good with the holidays coming up to help break out and better budget your money this season, but also still give you the resources you need to prepare for the NCLEX. So make sure you check us out online and see what that is all about. Lots of good answer choices. Let's show the correct answer is option 3. The medication will improve my spouse's confusion. So we need to figure out which statement is true. So all of the other options are incorrect, and this option 3 is the correct answer. Hepatic encephalopathy is a complication of the liver from a buildup of ammonia in the blood. So the liver is unable to convert serum ammonia into urea, so the ammonia gets built up in our blood, and that causes confusion, lethargy, slurred speech. So we want to give a medication to help bring that ammonia out of our system. So lactulose is a medication of choice. This it converts ammonia into ammonium in the colon in our stool, and it very quickly turns into diarrhea, but that's the way that it helps bring out all that ammonia. So option 1, it may cause constipation. It's actually the opposite effect. Oh, sorry. Actually the opposite effect. It will make your stool a lot softer and looser. So it has a laxative effect. Option 2, it is not administered as an injection. It is administered orally, or you can also give it rectally. And then option 4, it doesn't have any effect on the liver enzymes levels. It just affects the ammonia. So that would be the incorrect answer. So good job, guys. Question 6. The nurse is teaching a client how to self-administer enoxaparin. Which of the following statements by the client would require follow-up? Option 1, the needle will be inserted at a 90-degree angle. Option 2, I will gently pinch the skin at the injection site before administration. Option 3, the injection site should be at least 2 inches or 5 centimeters away from the umbilicus. And option 4, I should expel the air bubble in the syringe before administering the injection. Which would require follow-up? Let us know what you guys think. Also, do we have any recent NCLEX passers, or have you scheduled your test? We would love to wish you the best of luck or congratulations. So let us know in the chat if either of that applies to you. Let us know. Good job, guys. And then lots of good answers too. We have Bryson on TikTok that passed his NCLEX last month. So congratulations. Good for you. Welcome to the nursing world. Okay. Correct answer for this one is option 4. Which of the following statements would require follow-up? We do not want to expel the air bubble before injecting enoxaparin or a Lovenox shot. We want to keep that air bubble so they can get every last drop of that medication. All the other options 1, 2, and 3 are correct teachings and how we administer the injection. So we want to pinch the skin. We want to insert it at a 90-degree angle and at least 2 inches for the umbilicus or the belly button. So all good answers. Good job, guys. Almost done. Question 7. The nurse is preparing to administer Digoxin to a client. Which of the following findings would require follow-up prior to administering the medication? Option 1, heart rate of 56 per minute. Option 2, temperature of 99.1 Fahrenheit or 37.3 Celsius. Option 3, respiratory rate of 22 beats per minute or 22 breaths per minute. And then option 4, blood pressure of 90/48. Let us know which one Digoxin would need a follow-up on. Good answers, guys. And I love how y'all are putting some rationales to help teach the other people in your comments as well. So good job, guys. Okay, correct answer is option 1. Digoxin is a cardiac glycoside given to clients with heart failure. It helps increase myocardial contraction. So think of it as like making your heart beat better. If your heart is beating harder and better, we can expel the blood further and allow for tissue perfusion and then improve circulation. But with this, we don't want to administer it if the heart rate is less than 60, because sometimes with it beating better and harder, it can slow down the heart rate. So if your heart rate is already less than 60 and you give Digoxin, it can cause further complications. So you want your heart rate to at least be 60, usually a lot higher than 60, but it needs to be 60. So a heart rate of 56 is contraindicated in this case. The other options, temperature of 99.1, this doesn't really have any effect on Digoxin. Option 3, respiratory rate of 22 breaths per minute. This could actually get better if we have better perfusion to the tissue of the lungs, but not the direct linked with digoxin in this case. And blood pressure of 90/48, digoxin doesn't have any effect on the blood pressure, so that would be an incorrect answer. So you guys did good. Last question of the day. The nurse is preparing to administer an IV infusion of norepinephrine to a client. Which of the following actions should the nurse take? Option 1, insert an indwelling urinary catheter. Option 2, obtain the client's blood pressure every 4 hours. Option 3, place the client on continuous cardiac monitoring. And option 4, administer the medication as a secondary IV infusion. Let us know what you guys think. Good job, guys. I'm always so impressed on how good and how quickly y'all are able to answer it. Maybe I read slow, but y'all fill the chat with all y'all's correct answers. So good job, guys. Sierra, these are making me feel less stressed about the NCLEX. I am so happy that we are helping you feel a little bit better about this. So thank you. Ew, someone said cute costume. Thank you. I ordered it myself. Correct answer here is place the client on continuous cardiac monitoring. Norepinephrine or Levophed is a pressor medication, usually given in critical situations, critical care units. So think of it as a medication used to press down on our blood vessels and vasoconstricting them, so it increases our blood pressure, and then it also can increase our heart rate, so it just helps our blood circulation in general. With increasing our blood pressure and our heart rate, we want to monitor these patients very closely. It is given intravenously, so a lot of things can change quickly. So we want to be continuously monitoring them to prevent any complications. So that would be our correct answer, is putting them on a continuous cardiac monitoring. Option 1 is incorrect. They don't necessarily need a indwelling urinary catheter. As long as there's no kidney function failure or anything, it is okay for them not to have a urinary catheter. Obtaining the client's blood pressure every 4 hours, we do want to take their blood pressure, but every 4 hours is a little too long for a medication that does have a big effect on the blood pressure. We want to continuously monitor their blood pressure very, very frequently. So every 4 hours is a little too long. Not a little, a lot too long. And then option 4, administer the medication on a secondary IV infusion. We always want to give medications like pressors, paralytic sedatives on their own primary line in case there is an emergency and we have to turn it off or uptitrate it or raise the dose of it. We have a dedicated line just to that medication. So that would be an incorrect answer. So you guys did very good. Thank you guys so much for tuning in. I hope we taught you some things and I hope we made you feel better about your NCLEX coming up very soon. If you want to throw in some topics and other things that you guys would love for us to cover, make sure to send us a DM or put it in the chat as well. We love to create and help you guys in any way necessary. And then also happy Halloween if you celebrate Halloween. If not, we'll see you next week. Goodbye.